Hello, and welcome to Canine 101.
In today's episode, we're going to show you the canine respiratory system.
Firstly, there are 10 major components in the respiratory system. The nostrils, the nasal cavity, the pharynx, the larynx, the trachea, the lungs, the bronchi, the bronchioles, the alveoli, and the diaphragm.
The respiratory system is divided into two regions, the upper respiratory system and the lower respiratory system.
The 6 functions of the respiratory system are gas exchange, smell, filtering unwanted substances, warming and moistening incoming air within 1 degree of the dog's body temperature, vocalization, and temperature control.
Follow the arrow to observe where the inhaled oxygen travels. Air enters the external nares, which are the openings of the nasal passage. The internal nares are the openings at the caudal end of the nasal passage into the pharynx.
When inspired, air is warmed or cooled in the nasal cavity within 1 degree of the dog's body. There are short, thick hairs along the nasal cavity that work as a filter.
The pharynx is the common passageway for food and air. It extends from the back of the nasal passage and mouth to the larynx.
The larynx is also known as the voice box. The epiglottis works as a flap at the top of the larynx to prevent food from entering into the larynx.
The trachea is also known as the windpipe and is made up of cartilaginous rings that keep the trachea from collapsing. The trachea is the airway that transports air from the larynx to bronchi to the lungs.
Lungs are the main organ of the respiratory system. They are pinkish white in color and are connected to the bronchi. Each lung is divided into lobes. The right lung of a dog has 4 lobes and the left lung has 3 lobes. When lungs are squeezed, they have a spongy feel, and if placed in water, the lungs will easily float. There are alveoli at the end of each bronchiole at the ends of the air passages. Under low magnification, lung tissue looks similar to the netting. The strands of the net are the lung tissue and blood vessels, and the holes of the net are the air spaces.
The diaphragm is the primary muscle of the respiratory system. It is a thin, dome-shaped layer of muscle and tissue that separates the abdominal cavity from the chest cavity. The diaphragm flattens, decreasing air pressure in the lung, causing inhalation. When the diaphragm relaxes, the air pressure in the lungs is increased, causing exhalation.
Here is an internal view of the lung.
The bronchi branch off further into the bronchioles at the lower end of the air passage.
At the end of the air passage are the alveoli, which are tiny air sacs responsible for removing carbon dioxide from the blood and removing oxygen into the blood.
Thank you for watching today's episode on the respiratory system.
Join us for next week's episode.
It's heartworm season, and we have some extra tips.
Bye!